I'm Dr. Susanne Smith Roley. I'm an occupational therapist from Southern California. I'm here in Colombia. It's my third trip to Colombia, but I'm offering courses here on infant and child development, specifically related to sensory integration, and also to therapists who are very well trained already. We are getting together to do advanced clinical reasoning using air sensory integration methods in occupational therapy practice. One of the reasons that we are focusing on infant and child development in 0 to 3 is because we believe that early intervention is essential and that children who are identified early have a better opportunity to have better developmental outcomes. We think that if we can find the children who are at risk for difficulties or have difficulties very early in their development, that we actually change the trajectory of their development. One of the ways that occupational therapists interact with the medical community is by looking at what happens during the well baby checks. There are times when the families are bringing the babies back to the pediatricians, and during that time, the pediatricians are hearing some of the concerns that the family have about the development of those babies. From a sensory integration perspective, we're often looking at things that are hard to see because sensory integration disorders are considered hidden disabilities. So often the manifestations of problems in sensory disorders come in different varieties. So one type of baby we might see is a fussy baby, quite an irritable baby. They don't like to be held, handled, carried, bathed. Certain kinds of very typical daily routines are quite difficult for these babies. Sometimes they're very difficult to console for the families, and this makes it very difficult to parent these babies. Another kind of problem that we see in infants is the sleepy baby. The sleepy baby tends to be a bit under-responsive. They're sleeping too many hours. The mother is ready to feed the baby, but the baby is not waking to feed. When they do feed, they're feeding slowly. They're not getting a good meal. The mother has to keep waking them up. Oftentimes, the baby will be less responsive than what she wants him to be, or her to be. So the mothers may be engaging the baby, and the baby's looking vague or just not interested. Another kind of problem that we see with babies is that they're clumsy. They're not gaining good head control. Some of these babies don't like to be put in prone. They have difficulty moving their head from side to side. When you get them sitting up, they seem to be heavy. They're heavy to carry. And when they do start to move in that first year, they seem to be falling a lot. So this kind of difficulty often is linked to the vestibular system and their ability to gain postural control. The last kind of set of problems that we often see are babies who are somewhat disorganized, or what we would call dyspraxia. This we can identify quite early, even though we don't have standardized tests for this in early infancy. The very first sign of this we have is that the babies are not imitating the caregivers' faces. They're not playing those facial games that every parent does, which is sticking the tongue out. The baby sticks the tongue out, making vocal play, and the baby seems to be rather looking away. Maybe they're more interested in objects than people. As the baby gets older, they have difficulty figuring out how to use their body very efficiently to do things like reaching for objects or manipulating objects, or in the first year of life, then constructing, doing more imitative social play, and figuring out how to do things that are more complex, like representational play. So these kinds of things we then predict make it very difficult for these infants to predict what other people are doing, to plan their own actions, and to then develop more complex sequences of interactions. The most important thing that the families can do with their infants is to have a very healthy lifestyle. This isn't always easy, but as an occupational therapist, I care about how families are spending their time, and in some of the ways that they spend their time are do you have a healthy routine in your daily life? So you have nice schedule for eating, you have a good sleep pattern, you are getting some exercise every day, and this is going to also impact the health and well-being of the infant. One of the other things that we find in infant care is that the families have support systems. So in terms of the resiliency of the family, where is the support system for the mother or the primary caregivers? And this is also something quite important to decrease the stress of the caregivers, because that will also decrease the stress of the infant. When the infant is showing signs that their development is not proceeding typically, and often parents are comparing their baby to other babies, maybe in the family or other babies in the park, I think it's important to talk to your physician about their development, and then seek out the services of an occupational therapist who can do a developmental assessment. We're seeing more and more babies these days who are having difficulty with eating, sleeping, toileting. This is very concerning to us. One of the reasons is because of the epidemic we have worldwide in the area of autism. So it's a huge concern for us that we look at some of these signs and symptoms that emerge in early childhood in that first year of life, so that we can identify the problem areas, give supports to the families, and also work in a more preventative way. So perhaps we can prevent a full-blown diagnosis of autism if we can get these babies on a healthy track.